Everybody struggles from time to time. Meet Sarah. Sarah has been feeling sad for the past few months. She has lost interest in the little things that used to bring her joy, like going to the gym or meeting up with her friends. She's been struggling with sleep problems and can sometimes not even find the motivation to get out of bed in the morning. It feels like there's a heavy weight on her shoulders that she just can't lift by herself. Meet John. John has recently retired from his job at an insurance company. His newfound freedom quickly turns into boredom, and John starts drinking as he doesn't really know what else to do. When his wife tries to help him, he gets annoyed and shuts off. Little discussions turn into full-fledged arguments, which takes a toll on their marriage. When John looks into the mirror, he doesn't recognize himself anymore. When did he become so old? Where's the strong young man he once was? He's ashamed and refuses to talk to anyone about his feelings. Meet Linda. Linda is a university student. Recently, she can't focus on her studies and procrastinates most of her day scrolling through Instagram. Seeing the work piling up in front of her only increases her stress and makes her feel ashamed for not doing enough. She feels overwhelmed and wishes she could just snap out of it, but she can't. She feels as though she's become a burden to her family. Linda directs all her anger towards herself and goes as far as physically hurting herself sometimes. These are 3 examples of people who are experiencing mental distress. Can you identify with anyone? Everyone feels drained sometimes, after an intense conversation, or from stress at work. Sometimes it can also be hard to pinpoint why exactly we feel the way we do. Usually, these negative feelings pass, but sometimes it can feel like you're stuck. This is when we say someone is struggling with their mental health. Grasping mental problems might, however, be a bit more challenging than identifying, let's say, a broken arm. Our inner life is very personal, and many people might not wear their heart on their sleeve. Thus, it might not always be obvious who is struggling with mental health. People might deal differently with similar problems. While some suffer more, others might suffer less. For instance, while both John and Linda struggle with feelings of shame, John starts drinking and becomes angry, while Linda shows more self-directed and harmful behavior. Not only do people differ in their age and their gender, but also in other factors such as their personality and life circumstances, all of which might influence how they respond to mental problems. It is often not as easy as shoving people into the same box, or even in more specific boxes. This is because there's often not one specific cause for each of these problems per se. Rather, personal factors interact with each other, and thereby form the mental distress each individual is dealing with. For instance, sometimes a life event such as John's retirement might act as a trigger. This does not mean, however, that retiring will have the same effect on everybody. In other cases, there might not be a clear starting point for these problems, as we saw with Sarah. At first glance, it seems quite unclear why she has been feeling down lately. Here are the main take-home messages. People deal differently with similar problems. It is not as easy as shoving people into the same box. Factors interact and can thereby form mental distress.